Uterine prolapse is a condition that affects women, often causing significant discomfort and concern. It happens when the uterus, the pear-shaped organ in the female reproductive system, descends from its normal position in the pelvis, often due to weakened support structures. This occurs when the muscles and ligaments that support the uterus weaken or become stretched, which can happen for various reasons, including childbirth, aging, or heavy lifting. Uterine prolapse can be a source of discomfort and embarrassment, but thankfully, there are treatments available to manage the condition and improve quality of life. These treatments range from lifestyle changes and pelvic floor exercises to medical interventions and surgery. Understanding the causes, symptoms, and treatment options for uterine prolapse is crucial for women of all ages. Early detection and proactive management can significantly enhance a woman's quality of life. This essay will provide a comprehensive overview of uterine prolapse, empowering women with the knowledge they need to take control of their pelvic health. By being informed, women can make better decisions about their health and seek appropriate medical advice when necessary. Uterine prolapse is often associated with childbirth, but it can also occur in women who have never given birth. Factors such as genetics, obesity, and chronic coughing can also contribute to the weakening of pelvic support structures. It is important for women to understand the risk factors, symptoms, and treatment options available to them. By doing so, they can take proactive steps to maintain their pelvic health and seek timely medical intervention if needed. Several factors can contribute to the weakening of the pelvic floor muscles and ligaments, increasing the risk of uterine prolapse. Childbirth is a significant risk factor, as the process of labor and delivery can stretch and strain these supportive tissues. Multiple pregnancies, especially vaginal deliveries of large babies, further increase the likelihood of prolapse. Aging is another contributing factor, as the natural aging process leads to a decline in estrogen levels, which play a role in maintaining pelvic floor muscle strength. Other factors that can weaken the pelvic floor include obesity, chronic constipation, chronic coughing, and heavy lifting. These activities put increased pressure on the pelvic floor and over time can weaken the muscles and ligaments that support the uterus. Many women with uterine prolapse experience no symptoms, particularly in the early stages. However, as the condition progresses, symptoms may become more noticeable and bothersome. One of the most common symptoms is a feeling of pressure or fullness in the pelvis, often described as a sensation of something falling out. This feeling may be more pronounced after prolonged standing or physical activity, and may lessen or disappear when lying down. Other common symptoms include a bulge or protrusion in the vagina, which can sometimes be felt or seen. Some women may also experience difficulty with urination, such as a frequent urge to urinate, difficulty emptying the bladder completely, or urinary incontinence. Painful intercourse is another potential symptom of uterine prolapse. Uterine prolapse is classified into different stages based on the severity of the descent of the uterus into the vagina. This condition can significantly impact a woman's quality of life, and understanding the stages is crucial for proper diagnosis and treatment. In stage 1, which is the mildest form, the uterus has descended into the upper vagina but has not protruded beyond the vaginal opening. This stage often presents with minimal symptoms, and many women may not even realize they have a prolapse. In stage 2, the uterus has descended further, and the cervix, the lower part of the uterus, may protrude from the vaginal opening, especially during straining or bowel movements. Women in this stage might experience discomfort, a feeling of heaviness, or difficulty with bowel movements. Stage 3 is characterized by the uterus protruding entirely outside of the vagina. This stage can cause significant discomfort and may interfere with daily activities, making it difficult for women to lead a normal life. Stage 4, the most severe form, involves the complete prolapse of the uterus and vagina, turning the vagina inside out. This stage often requires immediate medical attention and can be quite distressing for the patient. The stage of prolapse helps guide treatment decisions, with more conservative options often suitable for earlier stages and surgical intervention often considered for more advanced cases. Treatment may include pelvic floor exercises, pessaries, or surgery, depending on the severity and the patient's overall health and preferences. Section 5. Conservative approaches, non-surgical treatments. In this section, we will explore various non-surgical methods that can help manage uterine prolapse effectively. For women with mild cases of uterine prolapse or those who are not candidates for surgery, several non-surgical treatment options are available. These options are designed to alleviate symptoms and improve daily functioning without the need for invasive procedures. These conservative approaches aim to manage symptoms, improve pelvic floor muscle strength, and prevent further prolapse progression. They are often the first line of defense and can be very effective when followed consistently. One of the most effective non-surgical treatments is pelvic floor muscle training, commonly known as Kegel exercises. These exercises are simple yet powerful and can be done almost anywhere. These exercises involve repeatedly contracting and relaxing the pelvic floor muscles, strengthening them over time. Regular practice can lead to significant improvements in muscle tone and support. Another non-surgical option is a pessary, a removable device inserted into the vagina to provide support to the uterus and hold it in place. Pessaries are particularly useful for women who cannot undergo surgery or prefer a non-invasive approach. Pessaries come in various shapes and sizes to fit individual needs and can be an effective way to manage symptoms and improve quality of life. They are custom fitted by healthcare providers to ensure comfort and effectiveness, making them a versatile option for many women. Section 6. Surgical interventions restoring pelvic support. When conservative treatments are insufficient or when the prolapse is more advanced, surgery may be recommended to repair the prolapse and provide long-term relief. The specific surgical approach will depend on several factors, including the severity of the prolapse, the woman's overall health, and her desire for future childbearing. One surgical option is uterine suspension, which involves attaching the uterus to surrounding ligaments or bones to restore its normal position. This procedure can be performed through an abdominal incision or vaginally. Another surgical option is hysterectomy, which involves removing the uterus. Hysterectomy is typically reserved for women who have completed childbearing or have other uterine conditions that warrant its removal. Section 7. Life after treatment. Managing and preventing recurrence. Following treatment for uterine prolapse, whether surgical or non-surgical, it is essential to take steps to manage the condition and prevent recurrence. This includes making lifestyle modifications, such as maintaining a healthy weight, avoiding activities that strain the pelvic floor, and treating constipation. Regular pelvic floor muscle exercises are crucial for maintaining pelvic floor strength and preventing prolapse from recurring. Women who have undergone surgery may need to avoid strenuous activities or heavy lifting for a period of time as they recover. Regular follow-up appointments with a healthcare provider are essential to monitor the condition and address any concerns or questions. By taking proactive steps, women can manage their condition effectively and maintain their pelvic health. Section 8. The importance of early detection. Early detection of uterine prolapse is crucial for successful treatment and preventing further complications. Women should be aware of the signs and symptoms of prolapse and seek medical attention if they experience any unusual pelvic sensations or discomfort. Regular pelvic exams are essential for women of all ages, as they allow healthcare providers to detect any abnormalities, including early signs of prolapse. During a pelvic exam, the healthcare provider will visually and manually examine the pelvic organs, checking for any descent or protrusions. Early detection allows for timely intervention, potentially preventing the need for more invasive treatments in the future. Section 9. Potential complications of untreated prolapse. While uterine prolapse is not typically life-threatening, if left untreated, it can lead to several complications that can significantly impact a woman's quality of life. As the uterus descends further into the vagina, it can cause discomfort, pain, and difficulty with urination and bowel movements. In severe cases, the prolapsed uterus can protrude outside of the vagina, becoming irritated and ulcerated. This can lead to infections, bleeding, and difficulty walking or sitting. Untreated prolapse can also affect a woman's emotional well-being, leading to feelings of embarrassment, self-consciousness, and decreased sexual satisfaction. Section 10. Seeking help. Your healthcare team. If you are experiencing any symptoms of uterine prolapse, it is essential to seek medical attention from a qualified healthcare professional. Your healthcare provider can assess your condition, determine the severity of the prolapse, and recommend appropriate treatment options. Do not hesitate to discuss your concerns and ask questions about your diagnosis, treatment options, and expected outcomes. Remember that you are not alone, and seeking help is a sign of strength and self-care. Section 11. Living a full life with uterine prolapse. Receiving a diagnosis of uterine prolapse can be overwhelming, but it's important to remember that it is a manageable condition. With the right treatment and lifestyle modifications, women with uterine prolapse can live full and active lives. Understanding the causes, symptoms, and treatment options empowers women to make informed decisions about their health. If you have concerns about uterine prolapse, don't hesitate to reach out to your healthcare provider for guidance and support.